All right, welcome everybody. We're going to call the meeting to order. So this will be the working session, and we have a single agenda item tonight. So the O&J Roberts School Board of Directors utilizes these working sessions as a process and a way to consider agenda items as one large committee for the purposes of discussion and debate in full view of the public. It's not a time for the public to engage with the board, rather a time for the public to observe the work of the various committees. That being said, we did put on public comment tonight for the agenda because it's the health and safety, and we know that there's been a lot of kind of changes in the public, so we're going to be accepting public comment tonight formally, unlike other committee meetings, which we tend to do it as a ad hoc basis. So, that being said, I'll turn it over to you, Dr. Stout.
Okay. Thank you, Mr. Friel. And Mr. Sanfran, do you have the slides up? I'm just going to go through the PowerPoint here that we have. Okay. Awesome. As Mr. Friel said, this is a working session meeting tonight, so this is not a voting meeting for the board. But what we're going to do this evening, as many of you know, there have been a lot of changes in the last several weeks. So what we want to do is we just want to do a review of our health and safety plan this evening, and I'll cover some of the key aspects of that health and safety plan, and then we'll take questions that we have from the board. And then, like Mr. Friel said, we're interested in getting public comment tonight as well. So I just want to reiterate there are going to be no changes to our health and safety plan tonight because it's not a voting meeting. So we'll review some of those key points, like I said. So the first slide we have here regarding masking, and obviously, and I'm going to be candid, this is the most controversial thing in our district right now. It's the most controversial thing that educators are dealing with across the country, and our community is not unique in that as well. I would think it would be evidenced today by the number of emails that both myself and the school board received over the weekend. But just as a reminder, the CDC does recommend universal masking indoors for all teachers, staff, students, and visitors in K-12 schools, regardless of vaccination status. So as a reminder, and I'm not going to pull out our actual health and safety plan, that is on the website, and people have looked at that, and people have access to it. The current health and safety plan at O&J Roberts requires masks when the Chester County transmission level is at the high or the substantial level. Again, I'm not going to go over the numbers tonight. You receive the numbers every Friday in our update. But what I can tell you is that Chester County has been at the high level since September. And if you're taking a look at the numbers recently, unfortunately, those numbers have not been trending in the direction we would like them to be trending. I think what I saw most recently on Friday was the highest number that we've seen so far this year. It was close to 300 people per 100,000. Our current plan has masking recommended when Chester County transmission level is moderate, and then mask optional when the Chester County transmission level is low. Couple reminders too. One of the big issues that we've run across this year with having to quarantine students is on our buses and then in the cafeteria as well. And I want to talk briefly about the buses. There is a federal order from the CDC. It was issued back in January 2021 that does require masking on all public transportation. That was most recently extended through at least March of 2022. So we are required, regardless of what's in our health and safety plan, to have students and drivers that are masked on our buses. Also, our health and safety plan does call for our desks being spaced 3 feet apart or greater whenever practicable. So we've been trying to do that in all of our classrooms. So next slide, please, Paul. So let's talk a little bit about the masking order. I think we all know where the masking order is currently. The masking order was issued by the Secretary of Health on August 31st and started September 7th. We have been following that masking order the entire time it's been in place. The order was set to expire on January 17th by the governor, but if you're following all the court proceedings, just on Friday, this past Friday, December 10th, the PA Supreme Court did overturn that masking order. So that masking order now is void. So there is no longer a masking order that is out there through the governor, through the Department of Health. So as I've shared all along, and we've talked at the board level and in our communications, we knew once that masking order went away, we would revert back to our current health and safety plan that was approved by our board back in August. So that's what we're following right now. So just some information on contact tracing. And I want to emphasize the point that O&J Roberts has quarantined 0 students. We do not quarantine. As a school district, we don't have the authority to quarantine. We don't quarantine. The quarantines are done by the Chester County Health Department. The Chester County Health Department, we report every single case to them. Our principals and our nurses assist in the contact tracing, but any quarantine letters come directly from the Chester County Health Department. So I wanted to make that clear because a lot of people think that we're making up the quarantine or isolation guidelines, and we are not. We are just following the Chester County Health Department's recommendations for that. Just a reminder, and this is in our plan, a close contact is someone who was within 6 feet of an infected person for a cumulative total of 15 minutes or more in a 24-hour period. You've heard me talk about this next point before, so there is one exception for the 6 feet physical distancing, and the exception is that 6 feet physical distancing is reduced to 3 feet, but this only applies to students, and it's only if the infected and the close contact students are masked. So again, I'm not going to get into specific data tonight. We've included some resources for you at the end of this presentation, but we have taken a look at the data so far, and the fact that our district, that we have been masked and we're able to use that 3 feet physical distancing, that exemption for contact tracing, if we did not have that in place, we would have needed to quarantine about 2.7 times more students. So just to give you an idea, we have quarantined roughly 1,100 or 1,200 students, and that was as of 2 weeks ago. The number that we received, if we could not have been masked and used that 3 feet, we would have had to quarantine, and this is just at the elementary level, we would have had to quarantine over 3,400 students if we did not have that masking exemption. So regardless of your thoughts on masking, it has allowed us to keep more students from being quarantined because we've been able to use that exemption and use that 3 feet. Some data and resources here, as you're aware, in the weekly report that I do. We always take a look at the Chester County Health Department numbers. We also have the O&J Roberts dashboard, and that contains our yearly totals in each building, and then our 2-week totals in each building as well, because that 14-day total is what we use as a key measurement in determining whether to keep schools open or not. Also, the PA Department of Health, their COVID-19 data for Pennsylvania, that's another data resource. CHOP, COVID's lab, has some interesting data as well. They also have a predictor model where they predict where the numbers are scheduled to go over the next several weeks. And then obviously we have the Centers for Disease Control and Prevention that the COVID data is there. So again, I didn't want to spend a whole lot of time this evening going over the specific data because we put the data out this week, and these are some other resources for the data, but I just wanted to include that there. So I mentioned this at the beginning, just if those of you that are interested in that timeline, because we didn't change the presentation after we put it out on Friday, November 10th, the Commonwealth Court held that the Department of Health masking order was void. At that moment, it automatically triggered a supersedis, keeping the order in place. Then November 16th, the Commonwealth Court ruled against the automatic supersedis. So the masking order was going to be lifted on December 4th. Then the PA Supreme Court got involved and they extended that masking order. But just as I mentioned at the onset, the Supreme Court started hearing the case on Wednesday, and Friday they rendered their decision voiding the masking in the district. So just to let you know some next steps, I mean, obviously we want to get input tonight. We've received a lot of emails. Any changes to our health and safety plan would not take effect until we have a school board voting meeting in January. So any proposed changes to that health and safety plan would be shared during a working session on January 3rd or thereafter. I have it down as January 3rd, but if we don't have enough data to have a meeting around the health and safety plan that night, then we would not be doing it on January 3rd. But just like we did with the other plan, if there are any changes to the health and safety plan, we will share it out in plenty of time before the voting meeting, so folks will have an opportunity to take a look at it and make public comment before it is approved. They said the next voting meeting is January 18th, so if we're making any changes, the earliest they could be made would be January 18th. And the last bullet does not apply because, as I shared, the masking order is currently void, so we're following our health and safety plan. So that concludes my report for tonight. Any questions from the board?
I have a question. I have
Sure.
a couple questions.
Yep.
Sorry, I don't understand this. Maybe you could just clarify for me.
Yep.
The exception with the masks doesn't apply to staff. Does that mean that if you're a teacher and you are within 6 feet of a student who is COVID positive, then you have to quarantine? You don't get that 3 feet
You are correct.
leeway?
You are
So
correct.
are more teachers being quarantined then because of that?
No, because many of our teachers are vaccinated. So if you are vaccinated, you do not have to quarantine unless you're symptomatic. And again, that's the quarantine guidelines from the CDC and the Chester County Health Department.
Okay.
So some of the areas where we've had the most quarantining obviously has been the elementary buildings where students are younger and did not have access to the vaccine prior.
Okay, and also, we talked about this before, and forgive me, I don't understand it fully. The buses. 3 feet doesn't apply to buses, and why is that, and who is enforcing that, and why do we have to enforce that?
Yeah, 3 feet does not apply to the buses. 6 feet applies to the buses. The only place where that 3 feet applies is in a classroom. We have, when I say we, our team, the Chester County superintendents, have had a lot of discussions with the health department to try and get that down to 3 feet on the buses as well. But that 3 feet exception is from the CDC, and it is only for classrooms. So we can't get that 3 feet number on the buses.
Okay. Thank you.
Sometimes logic does not apply.
Yeah. So I have a question for you, Dr. Stout. In terms, the challenge that we faced, under the last board and certainly again now is the quarantining and the loss of school time for kids.
Yeah.
Is there any other mitigation potentially coming down on limiting quarantine or a way we could limit quarantine that would be helpful to us? Because I think it's one of the biggest challenges here.
Yes, we're really investigating. There's a new process. Montgomery County Health Department has been using it. It's called Test to Stay, and it's where kids, staff, anyone can have several tests, and as long as they're testing negative on those tests, they can remain in school. Now, the one caveat with that, at least the way that it's currently written and being interpreted, is that you have to have a universal masking policy in place in order to do Test to Stay. However, we are looking at that and seeing if maybe we could do it differently. I know the CDC is also taking a look at Test to Stay. They have not weighed in on it yet, but Test to Stay would allow unvaccinated students who are close contacts to not have to quarantine.
Okay, and we're just waiting to hear what are the details behind that, and then if the testing would be available. And that could be potentially a mitigation that we could then modify the plan to limit quarantining for students and keep them in, because I think you said about 12, just elementary was about 1,200 students, and they average about 6 days in quarantine. So, roughly 3,000 school days missed versus 3,500 times 6 or 7 days. So, well over 10, 12,000 school days would have been missed had we not, been in mask optional versus the mask. So that's a dramatic school day missing. And so if we can find some mitigations to not have to quarantine that way or change our quarantine rules, I think that's, something we'd like to hear more about.
Yeah.
You think there's a chance that that test to stay would change? Because obviously, we'd have to adopt universal masking even in low transmission and moderate and all that, and I don't think that's a very popular idea.
Right. At this, currently, the program that you can apply for through the state, through the Pennsylvania Department of Education, requires universal masking to have a test to stay program. We want to investigate all other options, possibly not going with the state program and maybe looking at our own test to stay. So we're having meetings at the county level, trying to get some direction from the Chester County Health Department. But I've been meeting with a group of superintendents to really look hard at this issue, because we want to have kids in school, and we can't continue this forever. So we want to look at options.
So what would our own test to stay program, would the difference just be the cost of funding
It would be
ourselves
obtaining,
the tests and
correct,
such?
it would be obtaining the tests, so we'd have to get those on our own, and then we would have to provide the testing on our own as
Right,
well.
right,
But if you want to go through the state program and they cover the cost, then you have to follow their strict adherence.
Or if Chester County steps up and helps support all the school districts, that would be another.
Correct.
So if we can write to the Chester County Health Department, that'd be helpful.
Does the state program have a time commitment? For instance, could we stay in this program through moderate and high when our current plan calls for masking, but as we fall into moderate and low, come out of the program so that we could start removing masks and fund the program ourselves if necessary?
I'm not sure about that one. The language right now just says universal masking, but we would have to check on that. Just so you know, I did apply for that program. It came out on a Friday. I filled out our application on a Monday, and I figured at the very least we could decline it if we don't want to do what their restrictions are, but I wanted to get an application in so we could at least be eligible.
Are there any other board members that have questions?
Yeah. So one of the questions that I have is, I think we're very much dependent on our legal counsel, and we don't have our legal counsel here to answer it directly. But I would like to understand, when the state level mask mandate was struck down, was it struck down on the basis that masking is unconstitutional, or was it struck down on the basis that the governor's order was unconstitutional? Because that has a severe impact on whether our board is authorized to order masking within our school district or not.
Yeah, and although I'm not an attorney, I can attempt to answer that for you. I mean, from my knowledge, the governor's order was ruled unconstitutional based off of the changes that were made by the legislature that was approved through a referendum on the agenda. So he didn't meet the guidelines in order for the Department of Health to do a masking order. The guidance that we've received from our legal counsel is that, as local school boards, we do have the ability to do a health and safety plan and put mitigation factors in there, such as masking, if the board opts to do that. And that would be under Section 510 of the school code that gives the board the authority to do that.
Right, and I've read Section 510, and it's very vague.
It is.
It does not refer to medical or clothing requirements specifically, and so that's another legal question that I have. Is a mask considered a piece of clothing, or is it considered a medical device? because I've seen it posed different ways.
Well, and also 510, if you read like the second paragraph, it's talking about transportation and,
Right, things that don't
things
seem
that
to
have nothing to do with
apply.
any of this. So, and that, obviously, that paragraph is probably qualifying the one above, so it doesn't really seem to be applicable in my
Yeah,
view.
there are a lot more words in there that don't apply to this situation than do in that section of code.
I have a question. Are there school districts that currently have not been following a masking policy that we could benchmark against? I would like to have some sort of baseline that would inform a decision going forward about what, I think there's a fear of the unknown in making the decision about masking. And if there is examples out there that we could look to as far as those that have not been following a masking policy, what their current situation looks like.
Yeah, I think that's something we could look at if they'd be willing to give us the data. Because I know there are some districts, particularly now with the masking order being void, there are some districts that did have masks being optional. So they have reverted back. So I don't know when we could get that information, but the district would have to be willing to share that with us.
I'd like to make an attempt to try to get that information if possible.
Okay.
Yeah, hasn't Twin Valley been mask optional all along? And they're our neighbor?
I can't answer if they've been mask optional all along. They would have not been following the order. So I'm not sure when they took their masks off. I do know we have some districts that are not masking now.
Well, and also I know that like Bucks County, like a lot of districts in Bucks County are now reverting to mask optional. So maybe if we don't have data on some, like maybe we'll have data soon.
Yeah, and I think if we can get the data of, obviously infection rate, but also the quarantine, the loss of school days, and what are they doing to adjust for that, if they're required, and like we say, we're not quarantining anybody, but if they're
But if
seeing
they're
a
not
giant.
Chester County, then they're
Yeah,
not
how
under
are they-
our quarantining rules either, right?
Right.
Yeah,
Didn't
but
you
let's
say
see
that a
how
lot
that they're impacted, yeah, so if we.
I thought I
get that
heard,
data.
didn't you say a lot of the schools to the west that are also not keeping track of their own data?
Correct.
So we really wouldn't even have the data to compare ourselves against.
The schools in our area, I mean, we have the Chester County Health Department, there's Montgomery County Health Department, Bucks County Health Department. When you get outside of this area, there are not county health departments. It's done by the state health department, and they really don't have the capacity to track or monitor things.
And if they were within our county, they should have been masked because the mandate. And then they
All
would have
of
been-
the Chester County school districts were following the masking mandate.
Right.
There is one district now that in their health and safety plan had mask optional, and they switched to that today.
Like this week. Yeah.
Correct.
Okay. So maybe
We can get
mid-January, we
information
might have
Yeah.
some data.
Correct.
I'm sorry, I never got a complete answer. Will we have an opportunity to get legal counsel in public and ask those questions?
Certainly. Yeah, when we
Okay.
come back here, I can ask our solicitor to be here and answer that. But
I
can tell-
apologize because I thought tonight was the
Yeah.
occasion. And I came really, really armed with good questions.
Well, I think too, you should look back to the meeting minutes, because we did have this with the solicitor in public at the last board.
But not
with-
since the last decision on Friday. That
Ri-
is the
Right,
part
but
that
it-
we have not had a chance to.
But I think Dr. Stout's correct, that decision did not impact that piece of it.
Correct. That is.
But we can put them in.
That is the school code that we have been referred to, and we continue to be referred to, that gives the local school board the authority to make the health and safety plan decisions and any mitigation.
I understand that, but I see a lot of statements in public that have very, very different takes on what the legal decision on Friday meant. And I was really hoping that we would have somebody who could give us a better sense of what that legal decision made on Friday impacted, whether the purpose of that shifted the responsibility to the boards, and therefore it is our obligation to ensure that the health and safety plan specifically calls out masking, or if it took the responsibility away from us because masking was considered to be not constitutional somehow on Friday.
The governor just did not have the authority to issue the masking order. That was the ruling on Friday.
So would it be correct to characterize it as that pushes the authority to the school board rather than taking the authority away from the school board?
Correct. Yeah, and even Jake Corman, who was the senator who led the lawsuit, has stated specifically that it should be a local decision, not the governor's. So even in their case, they said it should be a local decision.
Thank you for that clarification.
Yep.
Okay, if there's no more comments or questions from the board, we're going to open up to public comment. So this is committee meeting. It's different than a voting board meeting. So if you have, questions or comments, I'll just say with the board, we can take a break and discuss it. If something new comes up or something, we can, I think, discuss it and be a little more interactive here as it is a committee meeting. Otherwise, we'll kind of follow the same procedure of, please identify yourself, your residence, your township residence. And then if you're on the Zoom, if you would use the raise hand function, and Paul, you can let us know how many folks are on Zoom, Paul?
131, but that includes a lot of our staff, and so it's 131.
Okay, so if we gave it an hour, that should probably, we'll try to shoot for an hour, and then if we're getting close and goes from there, we can kind of play it by ear. All right, so.
Would you like this time? Would you like the time? 3-minute time limit?
Yes, yeah, so we'll continue to do the 3-minute time. We'll treat it similar to a board meeting.
Before I start, is this only pertaining to health and safety?
Yeah, this meeting is strictly limited to health and safety.
So I sent you guys an email on Sunday morning. I know it was Sunday morning. And I did not get a response back, although I was copied on somebody else's email, and I did get a response back. So I really hoped that you guys would try to be transparent, which is what everybody that ran for school board ran on. And I want to thank Jennifer Munson for being the most transparent person here tonight, because there was no point in having this meeting without the attorney. None of you are attorneys. I am an attorney, and I did actually post in one of the public sites because you guys have a problem now. You guys are now sitting here, and the PA Supreme Court said the Commonwealth Court's decision would stand. And the Commonwealth decision has a lot of different interpretations on it. But I am pretty sure that the O.J. Roberts School Board does not have more power than the governor or the Secretary of Health, which I think she's resigning to, if I'm not mistaken. So you guys have opened yourself up now, if you continue this order, to probably other people, not necessarily me, because con law is not my specialty. But you might have people with civil rights actions if you overstep your power and whatever, somebody else might do it. But I actually have accepted the fact myself that you're going to continue to do it. So what I'd like to talk about is, I sent you an email that said, please fix the dashboard. You guys are asking for data from other schools that haven't done anything yet. Why can't we ever be the first one here at O&J to do something? If you made the dashboard and I gave you a sample from Terdiffer and East, copy their dashboard, then everybody can see what's going on. O&J Roberts' dashboard was better last year than it is now. But along those lines, at Terdiffer and East, I want to send you another email that if we're going to mess around with the masks, can we please do something else like academics? Because you guys ran on that too. December 13th is the deadline to put in an application for AP Capstone. And these kids at O&J Roberts deserve academics and not just listening to mask arguments that are ridiculous. Wear the mask, don't wear the mask. People wore masks before COVID, right? Nobody cares. I don't care if you, Jennifer Munson, wear a mask. I went to court today, Monco, I had to wear a mask. Chester County, I did not. I don't care who wears a mask. But you guys don't really have the authority to order the mask wearing anymore, and it's distracting from the academics here. I'm going to send you another follow-up email about that, because I wish you would just copy Terdiffer. They have languages in the elementary schools in 4th, 5th, and 6th their AP Capstone program. AP Capstone actually is put out there to make equity. It actually has a statement about equity, which is another goal that this board wanted to do, right? Another one too. They also have late start, right? You guys are so many other things to do than waste time on this mask order. Just make it recommended, which is what Dr. Stout said in August.
Thanks,
Have the
Heather.
3 minutes.
Appreciate it.
Thank you.
Yeah.
Hello. Tasha Morris, South Coventry. Is that what I need to? Okay. Good evening, everyone. This is my first time actively participating in a meeting like this, and I'm very excited to be a part of it. In the summertime, I was looking forward to having my son Lane start kindergarten at French Creek Elementary. I started logging in to listen to school board meetings so that I would know what to expect. When the mask optional plan was made, I was very pleased with the district's decision to start the school year this way. I didn't want my son to have any barriers in place when he started grade school. I was happy up until the very end of the last meeting in August when the plan was drastically changed and immediately voted on without public comment. I felt that the last-minute change was very unfair to the community. My heart sunk, and I was consumed with worries about my 5-year-old child having to endure starting in a new school and needing to wear a mask all day. I had thought that we were past this point in the pandemic and felt strongly that there must be other motives for continuing this masquerade. I can't believe it's December 2021, and this is still an issue. Somebody is definitely making money off of all this testing. As long as we keep testing asymptomatic children, the numbers will continue to be high. We have to stop testing asymptomatic children. COVID is here to stay. We are all learning to live with it. There are vaccines now for adults and children. We need to cease the practice of implementing any more unnecessary barriers that are harming our children and their education. How is a mask not a barrier when learning to read? In order to improve on our current health and safety plan, we need to immediately stop all contact tracing within the school and stop quarantining healthy students, period. No more testing of asymptomatic students. Now that we have a vaccine available for children, we should be past the point of needing to quarantine. 2020 has long been over. In order to repair last-minute damages made to the health and safety plan, we need to stop following county transmission levels weekly to determine if children need to wear masks. Masking is absolutely a medical intervention and should be a parental decision, as it always should have been. It must be impossible to continuously monitor whether or not each child is wearing a mask appropriately. My son has already told me about accidentally putting on masks that belong to other children, which is completely unacceptable. You should not leave this burden on teachers. As long as you keep testing asymptomatic children, the numbers will continue to be high. How many children that you test never develop any symptoms? Do you have data on that? I haven't seen it. I would argue that the school board does not have the authority to make masking decisions any longer. If the state health department does not have the authority, what makes you think that a group of 9 school board officials has the authority? I suspect that you will be dealing with some lawsuits. Lastly, if anyone was even considering it, we need to stop test to stay out of our district. Anyone who is thinking about implementing this is clearly out for their own political gain. If you are even considering this evil practice, I would expect you to be getting input from members of the community, unlike you did before completely changing the health and safety plan this summer.
Hello, Board. I'm John Lignelli. I'm a resident of North Coventry Township and a parent of 2 OJR students. In addition to being a parent, I am also a practicing doctor and the president of the medical staff at Pottstown Hospital. I'm telling you that we are in a healthcare crisis right now. Our hospitals are full, and it's not entirely because of COVID. It's a problem also of staffing, same as you guys. There's still plenty of COVID patients, and it's no surprise they are largely unvaccinated, but it is a lack of staffing that is causing the hospital to be full. The beds are there are not enough doctors and nurses to staff them. We could talk all night about the causes of this shortage, but it's irrelevant to the discussion. The result to the community is the same. There are no beds. If a hospital does not have any available ICU beds or can't staff an emergency operating room, they go on divert. This means that the ER cannot accept any ambulances from the community or transfers from other facilities. Last week, every hospital in Montgomery County was on divert. This does not mean that the ERs are closed. We are obligated to take whomever walks in off the street, but because of the shortage of beds, there's nowhere to transfer patients out of the ER, and the ERs become clogged with patients awaiting assignment, thus causing extensive wait times in the ER, sometimes as long as 10 to 12 hours. This is everywhere, not just here. But it's important for you to know that it is here. We are still in a level of high transmission in our community, and as the winter progresses, we are seeing the same trend we saw last winter with infection rates. People are getting sick, some are going to the hospital, and some are even dying. I don't know how the decision of a court by lawyers and judges changes any of that. It should have no bearing on how we choose to handle this public health crisis. A virus does not care about your beliefs, your political affiliation, your race, gender, or religion. It just sees a host to infect that it can use to replicate and mutate. For the good of our community, we need to be following the recommendations of medical professionals, not politicians. Masks are not 100% effective against COVID. Neither are vaccination. The only thing in medicine that is 100% is death. It is not about picking or choosing which mitigation strategy you think is best. You have to do all of them. It's like layering Swiss cheese. With each slice, you cover more holes and allow less to get through. We need to continue the masking policy, not just for the protection of our school community, but for our entire community. While there remains a significant portion of the population who persist in vaccination obstinance, the virus will continue to spread and undergo antigen drift. The only protection we have for our entire community is to get a vaccine, wear a mask, and deny the virus a susceptible host. Given the unchanged situation with COVID and the current state of our healthcare system, I feel that a change in the current health and safety protocol would be wildly irresponsible. Thank you.
Hello, Brooks Rowland, Warwick. Good to see everyone. So I was hoping, are you able to answer questions this time? I know we had talked about it. So I just want some clarity around, you said kind of Chester County and how you engage with them and how you cannot change the quarantine part of it. Is that correct? So you're at the mercy of how Chester County Health, but do you have an engagement with Chester County in that?
Yeah, we meet twice a week, all the superintendents, and with the director of the Chester County Health Department. So twice a week, she engages with us in conversation.
Okay, and so one reason I'm asking that is something that nobody is talking about is natural immunity, right? It's the gold standard. You'll see it in the email that I sent you today. You also, I think I might have talked about it back in August. I know we've had a number of cases, a number of children that have gotten the virus. I choose not to vaccinate my children, and I make that based on an informed decision as an adult. I'm not going to be forced in by people telling me that I need to get a vaccine for my child because they're my child. But my children have had COVID and they've all recovered from COVID. And so what I want to understand is even the CDC has recognized that natural immunity it has a long-lasting effect, just similar to the vaccines. So how's that being considered with the quarantine piece? And I don't expect you to answer the question right now, but that would be something that I'd like for you to be able to represent the community for those people that have either had it and recovered from it, or the children that have had it and recovered from it. How can we use that information from a natural immunity perspective? All right. Thank you.
Stephen Schuer, please give us your name and township of residence, please.
Steve Schuer, East Coventry. I've got some grandkids in the school system. I am a senior citizen. I am in that category of being at risk. And I remember as a child getting the polio vaccine. And I remember living in New York City, getting that polio vaccine to prevent me from getting polio. Among other things, the kids in New York City every summer were afraid of getting it. And when that polio vaccine became available, no parent, not my parent, no parent actually said anything about, gee, you shouldn't get it. they were thrilled that there's something to protect me from getting polio. I know that 60% of the population in this country are fully vaccinated. That leaves us with 40% who are not vaccinated. We need to protect the folks who are vaccinated and even the folks who are not vaccinated from the disease. And so I would fully support following the county guidelines as they follow the rate of infection. Thank you.
Thank you. Dawn Sweeney, please give us your name and township of residence.
Hello.
You are live.
Hi, my name is Dawn Sweeney, Warwick Township. Mrs. Munson, I just wanted to thank you for your very well thought out and educated questions, and to respond to your question about whether or not O&J can mandate masks. They cannot. The key word is agencies, a Pennsylvania agency. So the Commonwealth Court ruled, and the PA Supreme Court has affirmed that PA agencies, which includes LEA, a local education agency of which school districts are, do not have the authority to issue the mask mandates. And that's coming from the Pennsylvania Supreme Court. The Chester County Health Department is an agency and cannot mandate masks. The Pennsylvania Department of Health is an agency and cannot mandate masks. O&J Roberts is an LEA, an agency, and cannot mandate masks legally as of Friday. So today, it is illegal for O&J to enforce masks. Students can choose to wear them, but they are not, there's no legal authority per O&J, and that's probably exactly why the attorney is not there today. I think it's disgraceful that he's not, because everything that you're speaking tonight is a legal issue. So as of today, no student is required, and O&J cannot enforce masking. And 510 is a joke, section 5-510, that has to do with patrols. So I would be very concerned on a legal level that anyone at O&J is enforcing masks. And keep in mind that last year, masks were mandated and cases surged, they increased. This year, masks are mandated and cases are increasing, they're surging. So that's 2 years in a row of a mask mandate and COVID cases are increasing. How many years of wearing a mask are we gonna, and cases increasing, or at what point do you realize that masks are not a mitigation effort and are a failure as far as decreasing cases? Thank you.
Krista Collins, please give your full name and township of residence, please.
Hi, this is Krista Collins, East Vincent Township resident. I just wanted to say a couple of things. I completely agree that I cannot believe the solicitor is not there tonight. I don't know if that was a lack of communication or what's happening, but I think that this was probably like one of the most important meetings that we have his commentary for. But also I wanted to draw your attention to, and I'm not going to try to reiterate what everyone else is saying. Obviously, masks need to be made optional for many legal reasons, as Dawn just stated. But recently in Oklahoma City, a judge just found that a school district's policy of isolating healthy yet unvaccinated students is likely unconstitutional because it is a violation of the Equal Protection Clause in the 14th Amendment. So the next time you talk to the Chester County Health Department that seems to think that it is fair, just, and constitutional to isolate unvaccinated students and treat them differently, you may want to bring up this ruling, because even though this is in Oklahoma State, this does set precedent for the entire country because we're all under the same United States Constitution. So I would encourage you to bring that up and really push back on that policy because that is just completely discriminatory and really kind of mind blowing that our school district would even attempt to support that from the Chester County Health Department without pushback. That's all I wanted to say. So thank you very much.
Heather Zabicki is your full name and township of residence.
Hi, my name is Heather Zabicki, North Coventry Township. I'm curious as to why there's not an attorney on hand tonight, other than that you guys are trying to push this mask mandate at OJR out longer. And I think myself and probably a majority of the school district will request an additional working session with an attorney on hand before the January voting session. Thank you.
Hi guys, Todd Vrecchia, Warwick Township. Welcome to the new members. Tough time to come in. I wrote you guys a letter. I'm sure that some of you read it, and I can be long-winded in letters, but sent that over the weekend. I just had a couple questions. If you can answer them, great. Dr. Stout, I was wondering, is there any law in the state of Pennsylvania right now that requires the district to have a quarantine policy or a mask policy?
Good question, Todd. And I would say for the quarantining, yes, following the Chester County Health Department, but masking, that's a local decision. So there's not a law requiring masking.
What about as regards, you earlier referenced the federal government and public transportation. Now, obviously, our transportation is not federal. And obviously, the federal government cannot impose its will over the state. So my question is, what requires the district to comply with that, and is that a law?
Yeah, that is a CDC order that we're compelled to follow.
Okay. I guess my overall concern is that I do feel like we've gotten to a juncture where there's a question of legality and harm. And I'm just going to be honest with you guys. I mean, I have obviously kids in the high school, and I have a daughter in elementary school. I see what the mask looks like that my daughter brings home every day from elementary school. I don't care whether you're the oral surgeon who just spoke or whether you are a parent. You can look at this. There's no question. There's nothing sanitary about these masks. They're little kids. And it's really, really hard to breach the common sense test that should be applied to the health of our own kids. And to sit there and look at what these kids are wearing, or inadvertently swapping or falling on the ground during recess and think that this is something that's helping our kids. I mean, never a time in this country would we ever have said that. And while I respect earlier that, the person who called in was talking about the polio vaccination, and I get that, it was a little bit different. It was an actual vaccine. What's going on these days is a little different, and that has a lot of people nervous, including myself. Dr. Stout, I have deep respect for you. I do believe that your interpretation so far as the aspect of Pennsylvania school code that would enable the district to mask kids is definitely not in section 510 or in the 500s. The only thing that is in the school code is the 1400 series, and realistically, most of it pushes you out of the school code and into the other Pennsylvania law that deals with disease control and mitigation. But in all instances, it does not empower the school board with requiring, and to answer an earlier question, medical device. I mean, you guys aren't wearing the mask on your face as a fashion statement, right? That you're not asking the kids to do as a fashion statement. It's not an aspect of school dress code. It is a medical device. You are doing it for a medical purpose. And I think that you guys are really in shaky territory at this point, given the most recent things that have come down with the state.
Time.
Am I up already? See, 3 minutes goes by so quick. But listen, I guess I'll end this very succinctly. My thing is, as a parent, I've had to go along with this thus far, and I've been pretty quiet about it. but every single day that my children walk into this school and have to wear a mask on their face, I view this as irreparable and permanent harm. So if you're doing it illegally, you better be careful because it leaves you guys in a bad spot.
Okay,
Thank you for your comment. We have Samantha. Samantha, please give your full name and township of residence.
Hi, my name is Samantha Weber, South Coventry Township. I'd like to say thank you to all the new board members for your service in advance. I know this is a very stressful time. I'm a healthcare worker as well. I'd like to speak in support of masking. Obviously, the board has to figure out what to do with respect to legality, but I would say that the greatest danger to our kids is missing school. And I think we should come together as a community to do what we can to have the kids in school as much as possible. I think the board and the school district has done an amazing job. I also echo what the physician said earlier. Our hospital beds are definitely filling up. I work in home care in the community. We are primarily filling up with people who are unvaccinated. I'm also concerned about how Omicron variant is going to affect children. We still don't know exactly what is going to happen with that. So, you know, and with respect to people who say that masking doesn't work, I have medical grade masks that I've ordered in a pediatric size for my kids, and they wear them appropriately. So I think it all depends on your expectations. And I think having respect for each other and just trying to look out for those among us who maybe are immunocompromised, who, you know, need to be protected. I think we all need to remember that we're a community and we need to protect one another. So thank you.
Thank you for your comment.
Hi, hello. My name is Jill Oler. I'm from East Vincent Township, and I am actually in agreement with the masks being optional. But my concern that I don't know has been brought to anybody's attention is the school shootings and wearing masks. I know that they are not allowed to wear hats in school so that you can identify who that student is. I believe it would be very difficult to identify a student when they're wearing a mask. I also think if there was a shooting at the school, trying to run and do what you're supposed to do with a mask on is going to be very difficult. So I would like you to consider that when you are considering the safety of our children. Thank you.
Thank you. Trish Poley, please give your full name and township of residence. Trish is, as we wait for.
I'm sorry. Sorry
That's
about
okay.
that. I just wanted to say.
If you could just give
please
your full
talk
name
to-
and township of
Oh,
residence.
I'm sorry. Trish Poley, West Vincent Township.
Thank you.
Thanks. I'm sorry. Just wanted to tell everyone in the community, please talk to a medical professional. Talk to your doctor, talk to your pediatrician. Please don't get information or misinformation on social media. And if you talk to your doctor, medical professional, nurse, whomever, they're basically all in agreement that masks work. They stop the spread, vaccinations work, social distancing works. And we just really need to look out for one another. It's not just me. You know, that's not where we get over this pandemic. So that's all. Just thanks for your time, and thank you for the hard work where you guys are doing to keep everyone safe.
Thank you. Mr. President, we have a repeat person who wants one. Is that okay? Okay. Ms. Sweeney?
Warwick Township. And I would also like to speak about the quarantine policy. So we have data from each school building for contact tracing and quarantine. It's collected somewhere, but I feel like it should be assessed and used for the health and safety plan. Specifically, how many students have been contact traced, quarantined, and subsequently test positive? And this is data that should be used to determine if the quarantine policy is worthwhile or if it's overreaching. Since we don't have data, we're not transparent with data here at ONJ, but I did a poll where I asked ONJR parents if over the last 2 years your child was quarantined because of a close contact at school or bus, did they get COVID while they were quarantined, and how many days of school did they miss? 84 OJR parents responded. The average is 10 days of missed school, which is a combined 840 days of missed school by healthy children. And keep in mind, this is an extremely small data sample. You guys talked about 1,100 or 1,200 elementary kids being quarantined. 100% of the parents who responded had healthy children who did not get COVID while quarantined. And these healthy children missed a significant number of school days. I'm sure there were students who did get COVID while in quarantine. But with a lack of transparency on COVID data, we're unable to utilize the data, really effectively. The trend is clear, though, that students who are contact traced and quarantined are not getting COVID. And these healthy children are missing 10 to 20 days of school or more. And no, it doesn't mean the policy works, because the students were contact traced as exposed during school, not while quarantined. I really feel like this is a failed policy. Students who are quarantined are extremely high risk for mental health issues, suicide attempts, academic struggles, anxiety, drug and alcohol abuse, unsafe sexual situations. The safest places for students in school. There's an extremely large number of healthy students who are suffering in quarantine unnecessarily. Can you, or will you, I know that you can, collect the data from the phone calls and emails that the school nurses and principals to those who are contact trace, and see who is getting COVID and how successful or how much of a failure this quarantine policy is. You have 2 years of contact tracing and quarantine data. And I really think it's important for the students that we use it. And one last note regarding masks, regardless of the case numbers, regardless of the politics, regardless of your professional or personal opinion of masks, it is currently illegal to mandate masks on students. ONJ cannot. It's not a local thing. It's that ONJ, per the Supreme Court order, cannot mandate masks. If you continue to mask students, you open up the floodgates for lawsuits. Masks are an EUA. And
Thank you. That's the time. Thank you.
Thank you.
Taverner Bonsall, please give your full name and township of residence.
Hi, can you hear me?
Yes, we can.
Excellent, thank you. Taverner Bonsall, North Coventry. I'm still stuck on one of the first things Dr. Stout said at the start of this meeting, that if students were not in masks, there would be more than 3,400 elementary students at ONJ that would have been quarantined so far this year. That number is absolutely staggering. And before we consider changing the mask policy, we have to improve the quarantine process for students to make sure that they are receiving instruction. We have many students in our district who are voluntarily playing sports that are unmasked. So I think transmission is going to happen there. But if we can make the classroom the safest place for these students so that they can stay there, I think we have to make sure that we keep kids in school. So if they're going to have, if 3,400 students would have been quarantined had they not been wearing masks, I think it's crazy to consider taking masks off the students when transmission is so high right now.
Thank you. Christine Lewis, please give your full name and township of residence.
Hi, Mother.
Yes, you are.
Hi, I'm Christine Lewis. My kids go to West Vincent Elementary, and just to piggyback on some of the comments that I've heard throughout this, if we, sorry, I just lost my train of thought. Oh, yes, masks work, and we saw a decrease in transmission and illnesses in a whole last year, but that was when everybody was doing all of this stuff. Everybody was masking everywhere. Everybody was staying 6 feet apart, and everything was like this. And yes, while it does help to decrease infection, at what cost are we doing this? At this point, our kids that had a robust immune system have now had a crippled immune system, and just even the smallest colds are getting them ill and making them miss days of school. And while we have some form of education while at home, it really is laughable compared to what is happening in the classroom. My kids have been quarantined, and I got the pictures from school in the weekly email update from the teachers, and the things that they're doing in the classroom far exceed what education the kids are getting at home on quarantine, and to the point where they're not getting any synchronous education time with anybody while in quarantine. And for those kids that have IEPs and 504s, they are required to have in-person live teaching. And when you are forcing these healthy children to stay home, they're not getting an education. So all of this is coming to a head, and it's not sustainable, and we need to move past this. And there is no beating COVID. COVID is here. It's going to keep mutating, and it's going to keep being here, but it's only going to be a problem as long as we allow it to be a problem. We need to learn to live with it, just like we live with influenza and other diseases. Polio was killing children, and now we have a viable vaccine to keep children from being killed by a terrible virus. COVID has not proven to be horribly deadly to the children, especially the healthy children, especially the ones that got it and barely had a runny nose and now have natural immunity. It's time to move past this and teach our children what logic looks like, saying that they are allowed to go to any restaurant unmasked, to any grocery store unmasked, to play any of their organized sports unmasked, but yet they still have to wear a mask while they are running and exercising during gym class. Does not make any sense. Does COVID only stay in school buildings? Why are we
That
only
would be your
masked
time.
in the
Thank
school
you.
buildings?
Thank
Thank
you
you.
for your comments.
I have 30 more seconds. I wanted to add this before, and I forgot. I wish you guys would work together to do the right thing for these kids, because the mental health is not good for these children. And I have parents that come up and talk to me, and I've met so many parents during the past year, but you board members have so many other things that you need to get on top of. Like, I had a parent who was upset that confided in me that the 6th grade math placement tests for the math level you're going into 7th grade are happening next week before Christmas. That's like the most absolute worst time to give a math placement test or any test. So there's so many other things here that need to be worked on besides having to concentrate on this mask thing. It's not about whether the masks work or not. I think most of us will probably wear a mask whether you take that away or not. It's about whether you guys have the authority to actually do it. And I personally don't think that you do, but I don't think this district needs to waste a lot of time and money defending useless lawsuits, whoever's going to try to do it, when there's so many other things that you guys should be working on since we've lost so much during COVID. Thank you.
Rick Cameron, South Coventry Township. Welcome all the new board members. I think we're wasting a lot of time with this mask thing. I'm not going to bring that up. I do believe we're going to put the cameras back in the classrooms. If a parent thinks a child may have a sickness, parents more likely leave a kid at home and for a day or two instead of possibly spreading whatever that child has till they have the child tested. And the kids that are on quarantine, I've said this before, I said it back in August prior to the school year starting. If we're able to put the cameras back in the classrooms, the children can participate in class. We spent the money and the resources on it, why don't we use it? And the other thing I wanted to say, I brought up Wednesday night at the listening session, talking about safety, and a lady behind me said something. You had the shooting in Colorado, in Oxford, Michigan, a couple weeks ago. And a day or two later, we had a copycat. It ended up being nothing here, but what was the state police's response time? Was John in the building? Was he in another building? That is a big concern to me, is safety. And, you say it's scared, it's fear. Well, fear is when you're not prepared. And I don't think O&J Roberts is prepared. If you say we can't afford it, like I said the other night, you're literally putting a price tag on a child's life. It does happen, and we have the resources. And I think we should really look strongly at putting an armed officer in every building so we are prepared and ready. And he doesn't have to be in uniform. He could be dressed in everyday casual clothes and in a concealed state, and the children already know who he is as part of the staff. Just think about it, because instead of reacting, let's be proactive about it. In case something does happen, we know we can look each other in the eye and know that we've done everything we possibly could to protect the children. Thank you.
Mr. President, that's the end of public comment.
I want to thank everybody for participating and participating in public comment and sharing your thoughts with us. I think I want to open it back up to the board for some follow-up discussion based on public comment and some, requests for information. I think one of the, obvious things is, I know we addressed the legal issue before, and we've had, our solicitor come in and come on this issue, but I think it's probably a good idea for him to just give us his and their opinion based on Friday's decision, and circulate it both to the board, and then we can make it public as well. And then with that, I think when we talk about the quarantine and the education that's there, I want us to open it back up to the board based on just everybody, what we listen to now. If there's any other comments or requests by the board for information or things that you wanted to.
I honestly am disappointed that we didn't review the COVID dashboard during this meeting, because I know that it's available, that anybody can go and look at it at any time, but I think seeing the numbers together would have been very helpful. And also, the comments about, how many do we have per school that have had in-school transmission, which is the reverse of what we heard asked. They were asking, how many were quarantined and recovered where there was no in-school transmission. But the reverse of that is how many were in school and there was in-school transmission. I would really like to review those numbers updated.
Another thing that came up was the whole natural immunity piece, and an article flew by today. I didn't see it. I just saw the headline about the CDC talking about natural immunity. So I am wondering about our students. Are we having students who have had COVID, and then are they being additionally quarantined throughout the year from being close contacts? Is there anything that can be done if that's the case? Is there going to be some sort of update on from the CDC or whatever, Chester County Health Department, on natural immunity?
Yeah, that's a good question. Rich, do you know that? And I don't. If we're looking at that, kids that have previously had it and factoring that in when we do quarantining?
That's 90 days. They do. If they've been positive, they do not have to quarantine again for 90 days. But I don't know the research behind the natural immunity.
Okay, only 90 days though.
90 days. Yeah. I thought we were, but I wasn't sure.
There was another question too about, I'm going to now forget it because it was 3 or 4 comments ago, and for me that's like 3 hours ago. It was something about knowing if kids who are quarantined actually then had COVID, and we should know those numbers, and can we share those numbers? Is that accurate? I think my understanding though is that it's hard because the parents don't always then get kids they're quarantined, but they're not testing them, so we don't have those numbers. Is that true?
Correct. If they quarantine for 10 days, there's no test that needs to be done, so we would have no way to know whether or not those kids were COVID positive.
So we can't get those numbers that are reliable.
We would not know that. You have to test to shorten the quarantine from 10 days to 7 days.
I think we do have a close proximity to that because the majority of parents, I thought I understood, do get tested and they come back within the 7 days. So
Correct.
if you take, so that's worst case, that's worst case scenario, right?
So we do have a majority who get the tests.
The majority. And I
then
think
report
it's,
back.
if you do the math of it, and we could put this together to share it. So if there's, in-school transmissions was close to 200 that were infected while they were in school this year, and then caused the quarantine, and we had 58 then in-school transmissions. So it's a roughly slightly over 25% of the cases.
30%.
Yeah. Well, it's 198 and 50. It's between 25 and 30% are 30% of all cases are from the transmission in school under quarantine. So I think it was probably Dawn that asked that question originally in the public comment. It's roughly 30, and it's about 18% of the total O&J cases that are that in-school transmission. So that we're finding out through quarantine. It's probably a little understated because, as we said, we don't get every single kid tested if they go through the 10-day, but so that's probably biased a little low. So it's probably slightly higher than that, but it's around that.
And to confirm, those numbers that you're stating are this school year. It is August, when we
Yeah,
start, August 31 till now.
Correct.
We're only counting.
This year.
When we had an update on December 3rd by Deb Weber, our nurse, we were able to come 58 in-school transmissions this school year.
In all, I'm sorry, in all schools?
Yes, in all schools, 58. Since August.
And that was compared to was it 1,200 quarantined?
That was compared to the number we quarantined, 1,291.
Okay.
Just another comment that came to my head is, we're always talking about the fact that if the kids have masks and it reduces the quarantine and all those types of things, and, the 2.7 times or whatever. But the truth is, though, that just because we don't have masks mandatory doesn't mean no one was going to be wearing a mask anymore. So I think that needs to be taken into account. There are plenty of people that will not come to school without a mask.
And then the logistical question is, how do we report to the health department who was masked and who was not within 3 feet or 6 feet of the student, right?
Well, the same way they do now, because they just proximity. If they're wearing a mask, they don't include them.
Right, but right now, they do proximity and everybody's masked. If they do proximity and the teacher has to
Well,
rely
there's
on their
also
memory
vaccination status
of
too, so
who.
there's already differentiation has to make every student. has to
Right,
be-
but the teacher does not have to rely on their memory for vaccination versus unvaccinated. It's how do we document who's wearing a mask during the period of transmission on a given day? If we find out on a Monday that there was exposure in the classroom on Friday, and now we have to expect the teacher to remember who was masked on Friday?
Well,
Is
maybe they ask the student.
Are we obligated to continue following all that process, all of those processes, if we decide not to mask? I mean, I'm not clear on if the masking has been deemed unconstitutional at this point. What is the enforcement behind all these CDC guidelines and Chester County Health Department guidelines?
Right. We have been told, like, we assist the Chester County Health Department, but we've been told if we don't quarantine, that they would be doing the quarantining. So, I mean, like I said, we're not doing the quarantining. We're doing the contact tracing. They're doing the quarantining. But if we said, we're choosing not to do it, first of all, I'm not sure how legal that would be if we chose not to do it, but they said that then they would resume that or they would assume that task.
So notification of quarantining comes directly from the school, not Chester County Health Department.
Only because we're helping with contact tracing.
We do the contact tracing. We help with the contact tracing, but then the quarantine letter comes from the Chester County Health Department.
I only know this because my employer involved in that respect. It's the same, and they're in Chester County. Well, actually, no, Delaware County, but it's under the Chester County mandate. any COVID case that we have to report it to Chester County, or else we're liable if we don't. Then Chester County takes over. Our employer does the contact tracing, but Chester County is the one that's telling us what we have to do and what we can and can't do. It's similar, it's the same thing. Like, they are the ones that are saying, you have to quarantine for this amount of time. We're just doing the actual phone calls and relaying the message.
I think that would be another interesting question for the solicitor too, though, because you're saying that there are districts out in central Western Pennsylvania that aren't doing any of this. So they obviously don't have a health department that's saying you do this or that. So does Chester County Health Department have a legal, jurisdiction over us? Can they legally tell us to do things? And, how is that enforced? And I would just like to know more about that.
Okay.
Yeah, we can add that to the solicitor's question and there, to ask, Kathy's question. And I think that's the question here is, we're not doing any quarantining. It'd be nicer if the quarantine rules were different, but, we're not making the rules up. So our question is, if Chester County issues a quarantine letter, doesn't matter what our health and safety plan says, they're doing it, and they don't care what our plan says, right? So, it's a matter of, then do we abide by, official notification from Chester County or not? That's the question, right?
No, it's not up to us to abide. It's up to they're telling the person who's
Right.
been in contact with COVID. So they're the one that's abiding by it, not us. But we have to report it or else we're liable.
So since we have to quarantine, and since we have to quarantine currently, and it looks like it's going to be for a while yet, how can we do better with educating our kids that are quarantined? Because that's something I keep hearing a lot from parents, that they're not getting enough at home. And it is a lot, right? So we've over 1,000 kids, and then on top of it, it's 7 days. So what can we do to better educate while they are at home? And I think that's something we should really look into. I know there's a lot of staffing shortages, so I understand, but I think we just need to do better on that part of it.
Yeah, we've had discussions around that, and what I've heard from just a few parents that have had those concerns, and I've sent them back to the principals and haven't heard back again after that. So I'm encouraging them to talk with the principals, and we will find something that works for them.
I think we went over this number at one point, but just remind me. So we've quarantined like 1,200 some students at this point, based on the 3-foot rule, because students have been masked. If the mask mandate is optional, I think it would be practically impossible to assume that anybody's masked, and we would have to go with assuming that people are unmasked, because we won't be able to keep track of who's masked, who's unmasked. Kids might take their mask on and off during the day, and that would be difficult. So then that would put us into that 6-foot
Correct.
Range. And have we estimated, so far this school year, how many students would have been quarantined if we would have been at that 6-foot radius?
We were able to get the number, and let me just go through my notes here. We were able to get the number just at the elementary level, because at the secondary level, the kids go through 7 different classes, and to just calculate that number and the number of kids they would have contact with. But at the elementary level, that number, and I'll pull it here momentarily, is 3,441 was the estimate at the elementary level. So, and the number of kids that we quarantined in all of our schools, including the secondary, 1,291. So, like I said, we weren't able to do an estimate on the number of secondary kids, but at the elementary level, it would have been 3,441, as opposed to about the 1,000 that has been at the elementary level.
Okay.
Because most of the quarantines have been at the elementary level because of vaccination status.
So we're looking at, a possible 3 to 4 times increase in the envelope of people that we're quarantining if we
that we
make
would have to
masks
quarantine,
optional.
and then, the one thing I didn't mention is, unfortunately, we have not had to close any schools this year. If we get to a certain point where there's X number of students that are out, we would be forced then to shut down the school.
Have there been any schools in Chester County that have had to close?
In Chester County, not sure. I know there have been schools in other counties that have to close a few days or a week or so, but I'm not certain of Chester County.
They've closed grades, though. Multiple other districts have shut down, like ninth grade, I know, was it Boyertown?
At Boyertown, right, but I'm
yeah.
not sure about Chester County
And then
schools.
wasn't Springford another one? Like, they've shut down grades, not entire schools.
Right, and Springford may have had to. Correct.
And you have to turn it on to have Zoom pick it up. It's not that we can't hear you, it's that the folks on Zoom, if you don't push the button, won't be able to pick it up through the mic.
All right, so Dr. Stout, the other question that I had for the lawyers that I'm not going to make you answer is that one of the aspects of the conversation that I have not heard discussed, and I'm very interested in whether it's being discussed in the legal community, is about the transmission of virus through the air and, you know, the effect of the mask on the exhale versus the inhale, because you know, people who are wearing a mask to protect themselves say it doesn't work, but what I interpret of the data is that it works on the exhale, that if somebody has the virus in their body, the mask is intended to capture it before it gets into the air. So the other legal precedent where I could think of somebody exhaling and something getting into the air would be smoking. So we know that in the court systems, you are not allowed to smoke around children or in the place of an employment, of someone's employment, because your right to smoke does not supersede their right to breathe within that space. And I was just curious as to whether that aspect of the discussion has come up with regards to the virus transmission, if people are obligated to be masked, because if they were transmitting a virus by exhaling, it would be impacting the health of the other people in the environment, the way that secondary smoke would be. Have you ever heard anybody talk about it from that perspective?
I have not heard any legal discussions around that, no.
Yeah, it just, I was racking my brain trying to think of, you know, what other precedents do we have in law? And with regards to breathing and air, that was the only one I could think of.
The ultimate goal here, though, is the legality of the mask, right? I mean, that's what we're trying to get to at the core, regardless of the why. Is it like legal first, and then secondarily, then is it practical, and what other mitigate, you know, under what circumstances do we, if we feel, if then the legal says yes, now it's the school board's decision, then what factors do we consider? And then, you know, what are the impacts of those decisions? Quarantining, non-quarantining, loss of, you know, 18,000 school days or 20,000 school days versus 5 or 6 or 7, you know, and then what else can we do to educate folks if they're going to be quarantined and there's nothing we can do about it because it's out of our control. Right. So I mean, I think we have sort of like those concise issues of, you know, again, clarification to reiterate what we've been told by our solicitor, just so 1A, everybody's satisfied here at the board, and publicly we're satisfied that post that decision, feel we're on good ground. And then secondly, any other requests for data or sources of data that we can around this that we can then share publicly.
Yeah, I think we can all agree that, you know, we all want to keep kids in school as much as possible. I think that's, you know, the ultimate goal.
I just also want to add, I agree, and we've heard and we know that kids that are isolated are at risk for mental health issues, right? So is there a way, or are we checking in with our students who do have to quarantine to make sure, you know, they are doing okay, and what measures are we using to see if that's happening?
We are, at the elementary level, we have teachers assigned to them, substitute teachers that are assigned to students that are quarantined. The secondary level, we have academic coaches that are checking in with those kids that are quarantined as well. And I don't know, Rich, if you want to expand upon that. I know our counselors in mental health folks that we've hired in the district are also assisting.
Yeah, we've increased our contracts with outside staff coming in and working with students, academic coaches, and mental health coaches at both SAP offices in the secondary. And then I guess the secondary also with different resources online, et cetera. It's been working out. At the elementary, we've also increased our mental health since last year by 2 full-time contracted staff members. The counselors are working a lot of time along with the nurses to make sure students are taken care of, those who are on quarantine. I'm not saying it's enough, but there's a lot going on. And just one final thing, I'm checking each week with our staff to see if they need more. The difficulty is you pull in more folks, from contracted agencies or part-time, you still have to oversee those people as well. And sometimes there's a law of diminishing returns. The more you add, the more you have to oversee, and sometimes not as effective as you might think. So I think we're at a pretty good spot right now with the number of staff that we've added.
Last question I have is just the timing on the immunizations that we're doing for the kids. I know we did one shot. We had, if you could just maybe share with the public what the
Sure.
results.
And Rich, you know the specific numbers, so I'll turn that over to you. I know we have our second dose tomorrow night.
Yeah, a couple of weeks ago, we had our first one. We had over 600 sign up, and 533 first shots were given to 5 to 11-year-olds. So of the 600, we had a few no-shows, different schedules, double book, things like that. So 533. We're currently going through the list today and tomorrow morning, but we have about 540 that are signed up. So we're double checking to see who's maybe trying to show up, who wants a first shot or not. Unfortunately, we cannot give first shots tomorrow, so we've alerted everybody who signed up. We have a few double people who signed up, like mom signed them up and dad signed them up type thing. So we're double checking, but we're hoping to give out close to 533 second shots tomorrow. And then January 14th, tentatively, we're going to be offering boosters to staff, outside contractors that work for us, substitute teachers and paras, substitute clerks, and also bus drivers.
Sorry, one more question, Dr. Stout.
Sure.
You've been talking about how you, the superintendents of Chester County, are meeting together and trying to make plans and trying to work as a team. But then obviously Oxford has gone rogue and they're on their own. Are they, so are you no longer communicating with Oxford or?
Oh, no, David's at our meetings every week too. Yes.
Okay,
Yep.
so he has a place at the table to.
Absolutely.
Okay.
Yep. David, their superintendent is at our meetings twice a week as well.
Paul, I have a follow-up to your question or what you were going down as far as the legality question, and then looking at our next steps. I just want to make sure that at our next meeting, it looks like there's a working session on the 3rd of January, that will we have legal present at that meeting? And I think in the interest of being transparent for the public, that's a session where we'll be open to the public, where legal will be present, because there was a lot of questions and concerns about the legal questions around all of this tonight.
Yeah, we can definitely make sure that our solicitor is there. Again, we belong to various legal pools, and I know as soon as that decision came out on Friday, we were informed immediately that you revert back to your health and safety plan, and that was their interpretation. So I don't think they're going to be changing their positions, but I think it would be good to have them here.
Yeah, and that'll probably be, just so everybody knows, that'll be a full agenda. It won't be, this is a single committee meeting on health and safety. That is not, that's a full working agenda of, so the agenda is likely to be different. Which we can still have an update on this particular issue or issues that were raised at this meeting, but then there'll be a wider agenda at that meeting for the regular business.
Getting back to the January booster clinic, will kids and staff that have not had their first vaccine be able to attend? Because there may have been conflicts of interest, or maybe they weren't ready for the vaccine, but perhaps in January more people who had not been vaccinated will say, okay, I should go and get a vaccine. So will there be vaccines available for them?
Unfortunately not. It would be booster only. When they bring these doses to the high school, they transport them under specific circumstances, and they can only bring what we ask them to bring, that amount only. So I have to be pretty close to my counts and exactly which dose, what they're going to bring. So in this case, it would be just a booster. We can certainly look to see if, initial vaccinations are available. There are some available around in Gateway Pharmacy. Tower Health are the ones doing it for us. You can certainly call Gateway and do that.
Will secondary students be able to get boosters in January, or just staff and teachers?
On the 14th, we're just initially going to do staff. And then we have to see, boosters, I think, are available for 16 and up. And then we'd offer it to students at a separate session.
Because the staff primarily got the Johnson & Johnson, was that correct? And that's,
Some, yeah.
and that's now, not considered to be the gold standard, so they definitely need a booster.
That was the one offered through the CCIU, but many others got the two, something else.
All right, any more questions? And if not, then I am gonna, what? Man, I wanted to use the gavel. No. Meeting adjourned. Thank you, everybody.